Hi, this is Dr. Kavanaugh coming to you from ACR Convergence in Chicago, ACR 2025, and I'm at Room Now, and you're watching Room Now, the best place to go to catch highlights on many of the important topics happening. So an interesting topic in psoriatic arthritis has been sex. So now that I have your attention, it's something that we are paying a lot more attention to. Specifically, do men and women respond differently to therapeutic intervention? And backing up from that, do they have different baseline characteristics? Even though all patients have psoriatic arthritis, what impact does that have on our approach to the patients and our approach to therapy? So there's a number of ways that have looked at this. And this is something we've seen in psoriatic arthritis, maybe more so than in rheumatoid arthritis even, where there seems to be a discrepancy. Definitely women compared to men seem to have higher levels of disease activity across certain domains, particularly those related to pain. Men may have more severe skin manifestations, and we see this in a lot of studies. It's a super interesting area and one about which we don't have a lot of history. Only recently have we started to look at data according to sex. And once you do, it's very striking that we really need to do that pretty much for all studies going forward. If you had an imbalance in the sex distribution between an active treatment and another active treatment or placebo, that would definitely impact the results. So we're learning that we need to pay attention to this to help us interpret the results of psoriatic arthritis studies. This has not been looked at a lot in rheumatoid arthritis. It's been looked at in ankylosing spondylitis, where we see similar things that you really have to consider in a group of patients, the sex distribution, to make sense of the baseline characteristics, but more importantly, the response to any particular therapeutic intervention. We're seeing this has become more standard now in the reporting of studies, including some that are present at this meeting. When we see a new psoriatic arthritis study, we want to know, is there an impact of the sex difference in the baseline characteristics or in the response to therapy? Another aspect of that we have not really considered a lot in psoriatic arthritis relates to change in the hormonal status. I'm thinking specifically of the perimenopausal and postmenopausal status. We've thought of this in rheumatoid arthritis, and there, of course, it makes sense. The average age of the patients being a little higher in rheumatoid arthritis than psoriatic arthritis in general. The sex distribution being many more women with rheumatoid arthritis, whereas the sex distribution in psoriatic arthritis relatively equal, men and women. But we haven't paid attention to changes in hormones over time. That's something that's getting us a little bit of attention at this meeting, and I think it's something we're going to have to factor. If sex is important, then hormonal changes, and as they occur over time, how that influences the patients, how it influences the activity across different domains of disease, and most importantly, how that influences the response to therapy. So kind of a newish area, one that very rapidly has become the center of a lot of attention. We need to pay attention to this if we're able to really understand the data that we're seeing from so many of the new studies that are happening. So very exciting. Psoriatic arthritis continues to blaze trails and have important new information across multiple areas, such as the impact of sex. So I'm Dr. Kavanaugh reporting from the ACR Convergence in Chicago for Room Now.